Hello, I'm Dr.Ghoshal. Welcome back to the second episode of Dental Awareness. Today we are going to be discussing about tooth decay and pain. Patient reports to the clinic with pain, thinking that tooth removal is the best option to get rid of the pain. But that is not the only option. And to throw more light about this matter, we are going to include and invite my friend and dear colleague, Dr. Vignesh, who is a root canal specialist and endodontist. Hello, doctor. Thank you for joining us.
Pleasure, doctor. Hi, friends.
So, doctor, what do you think causes this tooth pain?
The most common cause for this tooth pain is dental decay. We call it as dental caries in our scientific terms. But you do have tooth pain because of a tooth fracture also.
Okay. So, if a patient reports to a clinic with tooth decay, what are the treatment options that you would suggest?
Okay, before moving on to the treatment options, let me show you an illustrative model of the tooth. The tooth has three parts, that is the enamel, dentin and the pulp. So if the dental caries is pertaining only to the first two layers, that is enamel and dentin, we can always excavate the caries or the infected part and then give a simple filling over it. But if the dental caries has progressed to the root canal part, that is the third layer of the tooth, then we'll have to go in for a root canal treatment.
Alright, doctor. So can you elaborate more on this root canal treatment procedure, doctor?
Okay, we'll move on to the model. So the root canal treatment starts with a local anesthesia. After anesthetizing the tooth, we excavate the necrosed part of the tooth, that is the infected part of the tooth. We clean it up and we access the root canals inside the tooth. Once after gaining the access inside the root canal, we clean the root canals and we disinfect the root canal with certain solutions to get rid of the bacteria. Then we shape the root canals with miniature pins like this. After shaping, we choose a suitable size GP, Gatapacha cones, and then we fill the canals.
If there's a patient who reports to the clinic with this pain, what they normally say is like they do not want to take up this treatment because the pain is so severe, and what they want is a medication to subside the pain, and then probably they'll take the treatment later on. What do you suggest for such patients?
Okay, I would say root canal treatment is the only option to relieve pain permanently. All these medications or any other minor dental procedures will only relieve pain temporarily, or it might lead to any other side effects also.
Okay. If a patient comes into practice, some of them have a different opinion about the procedure. Some wonder if there's going to be any harm related to the procedure. They ask if this treatment is going to cause any harm for the eyes, cause any harm for the brain, if they can take a shower after the procedure is done, and if they can take a head bath. A lot of such misconceptions are there. So can you clarify such misconceptions for the viewers?
These are some common myths which can be neglected by the patients because there is no evident data to back all this up. But in this era, there is pros and cons in any clinical treatment, maybe a dental or a medical practice also. So in this modern era of digitalization, there's hardly any margin of error. I would say it is insignificant.
Alright, that makes a lot of sense. That probably clarifies a lot of misconceptions which viewers have. Thank you for watching this video. Thank you for being part of this video, doctor. Please stay tuned for more dental awareness video. Like our channel, subscribe and share. Thank you again.